Hi everyone, welcome to today's debriefing session. Jennifer, Kayla, Lena, Jenny, and I will be presenting Mr. and Mrs. Geraldo's
To
case.
start off our debriefing session, I'll be talking about the situation, the priority concern of the family, and 3 developmental challenges that they're facing. Before we begin, here's a genogram of the Geraldos, so help us understand clearly about their family support. Throughout the interview, we were able to learn about this couple. For Mr. Geraldo, we saw that he was diagnosed with COPD 8 years ago. He was hospitalized for 7 days due to a pneumonia 2 weeks ago. Now, regardless of his respiratory condition, he still smokes 4 cigarettes a day, which is less than what he used to smoke. That he's losing weight due to undernutrition. This is mainly due to his COPD. While eating, he needs to take breaks, which annoys him, so he simply stops eating. From Mrs. Geraldo, we learned that she has cataracts, urinary incontinence, and that she's simply concerned for her husband's health. She's mainly concerned due to his COPD, his weight loss due to undernutrition, and that he still smokes 4 cigarettes a day. Based on what she said, her primary concern is that if he does not regain health, he might die soon and leave her alone. She stated this on numerous occasions during the interview. Here's an example. If he catch COVID, then I can't take care of him because he died, so then I'm alone. I'm scared. I need him to stop smoke to eat more. She wants us to help him stop smoking and start eating again. On numerous occasions, she stated her wish for us to help him stop smoking, but here's an example from the beginning. We're here because I need you to speak to him to make him to stop smoke. For our developmental challenges, Mrs. Geraldo fears death. She fears to die and leave her husband alone. For example, she does not go outside in the winter to avoid any severe injuries which could lead to death. She also fears that her husband dies before her and leaves her alone. She stated this on numerous occasions. She wants him to absolutely stop smoking and start eating again so that he can regain health. This can be compared to a norm, which states that research suggests that women in their 80s and 90s have a greater capacity to accept changes related to aging and don't fear death anymore, and have a clearer understanding of their life's meaning than women in their 60s. Mrs. Geraldo is 78 and is clearly not in this situation here, described in this norm. For a second developmental challenge, we have Mr. and Mrs. Geraldo's routine and life direction completely changed once they arrived at the résidence today. They no longer live with their daughter, son-in-law, and grandson, so they don't see them as often. And at the résidence, it's a completely new environment with new people. They no longer have visits from loved ones on random occasions, which they usually used to have when they lived with their daughter. And the food choices are different. When they were at home, with their daughter, they had Italian food, while at the résidence is not the case. And they also had family dinners with their daughter and her family, which gave them occasion to bond. When we can compare this to a norm, which refers to the continuity theory that states that older adults strive to maintain a similar lifestyle to their past. They choose to engage in familiar activities with familiar people. According to research, older adults preserve a higher degree of continuity in their activities and relationships. It is obvious that the mood that résidence doesn't allow them to do so. For our third and final one, Mrs. Geraldo is very stressed about her husband's health. She keeps thinking about the worst consequence to his health condition, death. Mr. Geraldo is stressed about his health condition, which makes him smoke. The norm states that most older adults are resilient. They have a positive outlook on their lives that help them cope with stress, and they bounce back when faced with adversity. This is clearly not the case, unfortunately, for Mr. and Mrs. Geraldo, as they are stressed for different reasons and have difficulty coping with the stressor.
So, if we had to describe our perception of what Mr. Geraldo is doing well and what is functioning well in his life, we would first start with sleep and rest. So, Mr. Geraldo takes the time to have a good night's sleep and to rest well. So, he takes several naps and he sleeps on an average of 7 hours per night. He takes a nap during the afternoon and one after supper, even though he still feels tired. Second of all, we find that he is really good to try and better himself because he is open to get better and improving his COPD. And he has tried nicotine patches and nicotine gum and even cold quitting, which is really good. So he is determined. And last of all, we feel like Mr. Zeraldo is trying to keep the medication. He is trying to take the medication adequately, and he is trying to take it on a daily basis in order to heal faster. But unfortunately, he doesn't know how to take it. That's what he he told us during the Zoom. So this might be a reason why he's not healing that fast, but it's also a great indication that something is going well in his life because he is determined to get better. If we had to describe a perception of what is functioning well in the family, we will first start with his wife. So Mrs. Zeraldo really cares for her husband. She really wants what is best for him, and she is worried about his health concerning either smoking or his eating habits and him losing weight. On the other side, we have her daughter. So the daughter of the Zeraldos, she takes care of her parents. She used to visit before COVID and even bring homemade Italian food. And that was comfort food for them. And Mr. Zeraldo really liked that food. So I feel like this is a good aspect to know that it's functioning well in the family because the daughter really cares. And lastly, as a couple, they feel like they have a good relationship, and even if there's a few ups and downs, they take care of one another. So even if Mrs. Zeraldo is not going well, Mr. Zeraldo will take care of her and vice versa, which demonstrates that the family is in some sort of functioning well and great. Last of all, if we had to base ourselves on the nursing analysis and what would be the nursing goals in this situation. So first of all, we feel like we have to make sure that Mrs. Zeraldo is also taken care of because she needs help with her cataracts, and she would need also us to truly listen to her because she seemed anxious and worried about her condition and her husband's condition also. Second, we have to, as a goal, this is on a short term and long term, reassure Mr. Zeraldo with his condition and help him cope with his stress. With COPD, he told us that his coping mechanism was smoking, which is really not good. So we could teach him and show him different types of coping mechanism because smoking is not the answer. And lastly, we feel like we have to assess on a long term Mr. Zeraldo frequently because he had difficulty breathing while he was explaining things to us on the Zoom. And he needs to know how to take deeper breaths, and he needs to know how to sit better, so in order to breathe better and take really deeper breaths, because that's going to help him not get exhausted when he's going to talk, and also breathe better on a long-term basis.
So now I will talk about the goals that we have established with Mr. and Mrs. Zeraldo. Mrs. Zeraldo is in a constant state of excessive worry. She has not been able to see a doctor for her cataracts because she is so worried about Mr. Zeraldo's health that she is incapable of leaving him alone. For Mr. Zeraldo, smoking cigarettes is a way for him to cope with stress. Their unhealthy coping mechanisms have reduced their quality of life and caused a deterioration of their mental health. So our first established goal is helping them find a healthy way to deal with stress and anxiety. The second goal is to reduce symptoms of COPD and improve quality of life for Mr. Zeraldo. Mr. Zeraldo's quality of life is reduced because of COPD exacerbation. Since his diagnosis of COPD several years ago, Mr. Zeraldo has not been able to do certain activities with Mrs. Zeraldo, such as dancing. And that adds more to their anxiety and frustration. The goal here would be to explore options that Mr. Zeraldo is comfortable with to manage symptoms. Lastly, Mrs. Zeraldo has spoken about her frustration that Mr. Zeraldo takes his medication Spriva with a glass of water, which is the incorrect method to take Spriva. Our goal here is to educate Mr. Zeraldo to take Spriva correctly with an inhaler. So how do we foster a collaborative partnership with the Zeraldos? Collaborative partnership is one of the 8 core values of strengths-based nursing. According to Dr. Lori Gottlieb's book, Strengths-Based Nursing Care, Health and Healing for Person and Family, nurses must be able to create the conditions that foster collaborative partnership by sharing power and being open, non-judgmental, and accepting. Our approach of having a collaborative partnership with the Zeraldos is to set goals together by listening to their needs and making a plan to better their health together. Secondly, it is important to make them feel accepted and heard by creating a safe environment where they have the freedom to share anything they would like is essential for their healing. Lastly, we treat Mr. and Mrs. Zeraldo with openness and respect. We are to communicate openly and in a respectful manner. Our goal here is to have a strengths-based nursing approach by including Mr. Zeraldo and Mrs. Zeraldo in their care plan. To address their concerns, our first nursing intervention is to listen actively and communicate awareness of their anxiety and suffering. The rationale here is that it validates their anxiety and stress and demonstrates recognition of these feelings. By showing empathy, Mr. and Mrs. Geraldo can have reassurance that these emotions are absolutely normal and a part of the human experience. Our second nursing intervention for them would be to encourage smoking cessation for Mr. Zeraldo. Even though he has tried various methods to stop smoking, such as nicotine patches, there are still alternative options for smoking cessation if he's open to them. The rationale here is that smoking cessation is the most effective strategy for slowing down the progression of COPD and maintaining the rest of the lung functions. The third intervention would be education for Mr. Zeraldo on medication adherence. The rationale here would be that not taking the Spiriva as prescribed can lead to his COPD getting worse.
All right, so the SBN value that I chose was environment. And I chose this because person and environment are related and they both impact each other bidirectionally. So for the current environment, I just chose to identify some issues that maybe could be fixed. So for Mr. Zeraldo, he has COPD. He's been smoking the majority of his life and he wants to quit, but is just unsure how to start and is also prevented by several social factors in his environment, such as his friends who smoke. And then on top of that, he's just got some appetite issues. This could possibly be impacted by stress or just the unfamiliar food at the long-term care home that he lives in with his wife. And it's impacting, he's losing weight because of it. And then for Mrs. Zeraldo, she's got several of her own health issues. She's incontinent for urine. She has cataracts, but she's afraid to get surgery to address that problem because she's worried her husband won't have anyone to take care of him. And then in addition to that, she's also unsure how to convince her husband to quit smoking using positive reinforcement instead of negative, because the current tactic that she's using is just withholding sex, which is negative reinforcement, and that might contribute to negative self-image for Mr. Zeraldo, which could ultimately, lead to not accomplishing the goal of quitting smoking. And then, so goals for environment would be just for Mr. Zeraldo, first of all, to quit smoking and to be able to confidently go into social situations where there might even be other smokers, and he might feel pressured and be able to navigate that and find healthy alternatives to smoking. And then stabilize Mr. Zeraldo's health so that Mrs. Zeraldo can address her own concerns and be able to seek her own care. For the approach, I thought that it would be good to identify challenges in the environment and what could potentially be changed to facilitate smoking cessation for Mr. Zeraldo. And then for Mrs. Zeraldo, identifying changes that she wants to see in her husband and in her relationship before she feels safe to seek care for her issues. Then also for Mr. Zeraldo, identifying alternatives to smoking in social situations, and also healthy coping mechanisms for stress. And this would impact his appetite as well, because if he can find better ways to deal with stress, then he would be less stressed, and this would perhaps increase his appetite. And also smoking is, he did mention that if he's stressed, he will smoke a cigarette. So finding a way to deal with that that's not smoking. And then lastly, for Mrs. Zeraldo, finding better, more positive ways to motivate Mr. Zeraldo to stop smoking, positive reinforcement instead of negative. The question that I thought would have been good to ask during the interview was, Mr. Zeraldo, how do you think your smoking is affecting your personal relationships? And I think this is a good question that really has to do with environment, because it encourages Mr. Zeraldo to reflect on his environment and his relationships socially and his marital relationship, and weigh the pros and cons, and really think about the strain that this habit is putting on his relationship, and probably see that the net impact of this habit is negative, and it's negatively impacting his relationships. And to stop smoking would positively impact his health, his wife's health, so positively impact a social relationship, and just allow him to see that quitting would be really positive for everyone.
So after having a clinical interaction with Mr. and Mrs. Zeraldo, we figure out health and healing is one of the important aspects of value to go deeply. So health and healing is more relationship on creating the wholeness of a person. So for helping us to explore the current state, strength, weaknesses, desired state, and goals. So it guided us to explore maybe the severity of COPD or smoking of Mr. Zeraldo, even how bad appetite causes his weight loss. And for Mrs. Zeraldo, it's more on how it impacts her daily activities because of having cataract or urinary problem. And move on to strengths and weaknesses. Strength is divided into two components. Character strengths, for example, are they open-minded? Are they willing to learn? And for family resilience, is more into the relationship of Mr. and Mrs. Zeraldo. We also mentioned it about weaknesses, as it helps us to know how strength can support their weaknesses to minimize any other weaknesses. And for desired state, we divided into habits and attitudes. So habit is how they wanted to change their habits in the future, and even how they want to change their behavior, attitudes. And for goals is to provide healing for them and even helping them to understand their barriers. After exploring the different components, we will start by approaching. So we figure out Mr. Zeraldo is suffer from COPD or even try to quit smoking. So we could advise on how to stop smoking, for example, promoting pharmacotherapy, and even having a shortness of breath while eating that he would feel it in the interaction. We could suggest some kind of meal plans. And for Mrs. Zeraldo, she mentioned she cannot see clearly or even control her bladder. So we could provide bladder training or even provide more information on cataract surgery. Afterwards is about strength and weaknesses. And we see Mr. Zeraldo is ready for quitting smoking. And for Mrs. Zeraldo, she do have a good understanding of health, and they do have a good marriage relationship. So it guided us to have some approach on setting treatment plan for their engagement together to promote motivation with each other. And we do find that Mrs. Zeraldo is lack of self-care as she over-focus about her husband's health. So we could try to contact the resident Soleil to provide more additional care service for Mrs. Zeraldo. And afterwards is the size, date, and goals. So they both wanted to play with grandson or even dance or cook or to be more healthier. And for goals,
Mr. Serrato want to quit smoking and Mrs. Serrato want to enhance her vision and urinary issue. So we can provide some kind of suggestion like making a smoking plan for Mr. Serrato, and for Mrs. Serrato is to having a more fluid and diet management. During the interaction, there's one question: have you ever tried stopping smoking? Although it is a yes or no question, but we figure out that it is the question that starts the topic on how Mr. Serrato used his own method to stop smoking. And Mr. Serrato shared about his own method, maybe like patches or gums that he used, but it's not effective. However, they help us to know and to understand to promote other intervention. And he shared about quitting smoking is hard, so it is his own experience that he can learn from. And even he is actively participate, so we are sure about his readiness of stopping smoking. So it helps us to continue to promote health and healing, and even to apply this SBN value. That's the end for our debriefing section. So next week we could plan to make some treatment plan for Mr. Serrato and Mrs. Serrato. So are you guys available for it?
Yes, absolutely.
Okay, great. So see you guys next week.
Great. Thank you guys so
Bye-bye.
much. See you next week.
Bye.
Have a nice
Bye.
day.